Hello, I'm Martha Kennedy, CCS, and today I want to talk to you about behaviors, reasons why our residents may have behaviors, and way to de-escalate. So I can tell you, if you just think about it, we've all experienced a time where we were overwhelmed or tired or under significant stress or maybe had pain. And this definitely always has an impact on how we respond to different situations or maybe compounding situations on top of that. We also all carry our own trauma and past experiences for every situation. So we can be different in our responses when it comes to situations. So I want you to just to remember that our patients, our residents are also like this, okay? So when we're faced with angry, hostile, or non-compliant behavior from our residents, the key is to avoid physical confrontation, de-escalate, try to find out what the reason is that this is going on with the resident. Is it an unmet need? Are they in pain? That's one of the big ones, pain. I know that when I'm in pain, I'm a little short-tempered, right? Because I just want to get rid of the pain. So that's one thing, an easy thing that we can do is try to find out if it's pain. Now, I'm not going to be able to ask them, are you having pain? They may not be able to tell me, but I am going to look for those nonverbal signs and symptoms of pain and treat the pain. We need to be empathetic or non-judgmental, use non-threatening and verbal language. Avoid overreacting, okay? You don't want to bring a lot of people around, to all come help, because that's just overwhelming for the patient. We need to rule out any other medical problems. Is there, are they having a UTI? UTIs can cause depression, behaviors, make you think that someone perhaps is getting worse with their dementia. So we've got to try to figure out what's going on. In the meantime, we've got to look at the short-term de-escalation techniques that we talked about. Try to focus on the feelings. Support how they feel. That must be scary. It must be hard on you. Let them know that we're here, we're listening. Ignore any challenging questions, like what's going to make you feel better. Things like that. Don't make them think. Choose wisely on what you insist upon. If they say, I don't want to go take a shower, I don't want to take my medicine, then back off and allow them to calm down and then come back. Allow them some silence for reflection. Allow time for decisions. Don't rush people. When people feel rushed, they don't like to make those decisions, especially when they're wound up. Some long-term things we can do is, again, to address the needs of the individual. I think that's very important. Perhaps they have a headache, perhaps they're having leg pain, back pain. Then let's get with a doctor and see if we can do something to keep that pain away, by maybe prescribing Tylenol regularly so that we don't get back up to this. So it's understanding what's behind the behavior, recognizing and responding to any defensive behaviors, and just using what our CNAs and what we know about the resident to try to bring that resident back down to a place where we can actually deal with them, and we can help the frontline staff make it easier, because we know that they're dealing with this all the time, and just try to help this resident and know the triggers, care plan the triggers once we find them, so that those that don't know will come and we'll be able to see it in our documentation. Make sure our other residents are safe, and understand that maybe this might be a reoccurring problem or pattern, but we know how to deal with it each time it happens. Talk to the family. Make sure your tone of voice and your approach are good. You don't want to rush up on anybody. You want to make sure that your tone is good, just like when you would speak to a child or an animal or anybody that's upset. We don't want to come in like this. That doesn't work, right? So we want to take a low tone and let that tone know that or not the tone know, but let that patient know that it's okay. I'm here. I'm not rushed. I have the time for you. and you're going to be okay. Thank you very much for listening, and I hope that this helps you in some way.